Um, Welcome, everyone. Thank you for being here with us tonight for AngelMD's Pitch Club, focused on innovative uses of telehealth. I'm Katie Richardson. I am our Vice President of Clinician Relations, and I'm going to be your hostess with the mostest this evening. I want to start by introducing you to our AngelMD team. We have Tobin Arthur, who is our founder and executive chairman. We have Jennifer Arthur here tonight, who is our co-CEO of membership. We have Mike Raymer, who is our chief strategy officer, and we have Mike Szymanski, who is our head of finance and investment. We also have three great startups here that are going to pitch for us tonight. But before we move on with that, I'm just going to give you a brief overview of what AngelMD's Pitch Club is all about. We really have been doing this every 2 weeks now for the last few months. And the purpose of Pitch Club really is for clinicians, scientists, dentists to get to see what new and innovative technologies are out there and available for their use. This is not specifically about investment, although if you're interested, there are opportunities to do that as well. But most of this is for fun, is for interest, as well as for our startups to get some feedback from our AngelMD clinician community. With that being said, the format for tonight, each startup gets about 7 minutes for their presentation, followed by 5 minutes of Q&A. If you have Q&A, if you have questions, we want you to put those in the Q&A function on our Zoom platform here. As well as after the Q&A is finished, we will put up a poll, which will allow you to give feedback to the startups. And again, the startups value your feedback greatly. They take all this to heart. We share all the information with them. And it's something that, as we hear from all of our startups that are pitching, that they really, really value the feedback that they get from our clinicians. So without further ado, we will go ahead and get started tonight. And again, welcome to everyone who is here. Again, we're talking about innovative uses of telehealth, and we're going to start with Dr. Jim Cerruti, and he is the CEO of TelehealthCare Solutions. Welcome, Jim. Thanks for being here tonight, and we look forward to learning all about the VP exam.
Great. Thanks for having me. I think I've successfully shared my screen, but somebody feel free to stop me if I have not. All right. So I'm an invasive cardiologist is my day job, but I founded the VP exam as a comprehensive telemedicine platform, and its real focus is on problems related to transitions of care. We're trying to reduce readmissions. About 1/3 to 2/3 of rehospitalizations from skilled nursing facilities could be prevented. And many times the signs of clinical decompensation are not noticed early enough in the clinical course. So this hurts our patients, which we care most about, but also our hospitals and our nursing facilities, and CMS penalties result from poor outcomes. So telemedicine is a great opportunity, but we're missing important data. What we really focus on is the lack of physical exam data. This reduces our clinical confidence, and it can result in malpractice suits for misdiagnosis and delayed diagnosis. So we built a system focused on automated teaching and augmented reality. It walks the nurse or the patient through how to perform a physical exam. Augmented reality helps ensure that you have the proper positioning of both the camera and the distance, as well as the stethoscope. In our previous pilots, we could use this in nursing facilities and reduce readmissions by about 20%. We think there's even greater opportunities for some of our very high risk COPD and heart failure patients, our sickest of the sick. And one of the keys to working with hospital systems that I'm trying to hit on here is integration. We put a lot of focus on integrating with scheduling, billing, and EMR systems. Probably the most known would be Allscripts, Cerner, and Epic, which we can tie into. And experience has shown us that this is the integration that is required for successful telemedicine for both physicians and for patients. So this is a quick run through. This is an example of looking for changes in jugular venous distension. And by seeing that earlier and the software walking the user through, we can detect heart failure decompensation sooner. This is augmented reality just showing how to perform lower extremity edema assessments. We can do other things, range of motion, wound healing, things like that, just with video exams and the software. And then we can move on. So we've connected to Bluetooth stethoscopes. This is a Littman 3200. We've also partnered with Echo, and they make a duo stethoscope that's pretty exciting. It can do a single lead ECG. You can hear a murmur very clearly, and the software walks the user through where to position the stethoscope step by step. And you can also do a full pulmonary exam. You can detect crackles and things like that earlier. And this is our web portal where you can quickly pull up all the data. You can also see review of systems, histories, and all the other data that's transmitted. And then you can quickly and easily shuttle the patients into the appropriate waiting rooms. So we maintain HIPAA compliance, but the physical exam is really the difference that sets us apart. The architecture of the VP exam was meant to be comprehensive. We focus on all the things that hospital systems need: easy registration, voice recognition for histories and review of systems, and the augmented reality physical exams. We can also send vital signs, medication reconciliation, document scans like EKGs and chest x-rays, as well as smartwatch data. So it's a really a one-stop shop for telecardiology, which is a great niche. So in the end, the physical exam data is what really sets us apart. We can take care of very sick heart failure patients, very sick COPD patients. And we think the physical exam data really helps set things apart and our management apart. So taking a look back, we were founded in 2014. We received 2 National Science Foundation grants for innovation, around $100,000. In 2016, we started piloting at skilled nursing facilities. This is where we got to the conclusion that we could reduce readmissions by about 20%, and we could improve patient satisfaction as well, which is a great selling point. We have FDA oversight as a medical device data system, and more recently, we've been awarded a contract from University Hospitals of Cleveland to develop the Harrington Heart and Vascular Institute digital health platform. And this produced revenue of over $200,000. Evidence supports the subscription revenue could range from $500,000 and should range from $500,000 to $2 million in the upcoming year. And we're also participating in a quality improvement project with university hospitals where we're using cardiologists, nurse practitioners, and residents to improve transitions of care. This is all key to helping increase our exposure nationally. We also have 2 more medium-sized hospitals interested in initiation. So we plan to leverage our technology. We want to partner with various size hospital systems. We think we can sell the point that we're selling improved quality of care, improved transitions of care, and we can also optimize billing complexity. And we also want to explore the new niches of telemedicine. I mentioned telecardiology is a huge opportunity. We're going to move beyond nursing homes into home health. University Hospitals has been very interested in moving to home health and the concept of hospitals at home to help reduce readmission rates. And we think this is the future of telemedicine, is to move more into the home step by step, and this helps bring the physician, the care providers into the home. So we also have some conservative financials here, and we think there's opportunities to increase this by at least 3 times what we're projecting here. Essentially, we're producing a SaaS model, and there's 2 main services. The first is an initiation service, and this is to integrate. This is that tie into the scheduling, registration, and EMR that I talked about earlier. And we think that this can easily generate $200,000 to $1 million per hospital. The nice thing is, as our system proliferates, it becomes easier for us to tie into these systems as we gain more and more experience. We also think there's a lot of room for subscription-based services. We think this is the bulk of the market. It usually would scale based on the number of providers and the number of patient encounters per month. we can see revenue of $500,000 to $5 million annually per hospital system. By the end of 2021, we plan to partner with 5 additional health systems, which will put us in a good position for a Series A round. The seed fund that we're currently undergoing is to grow our executive team, our software engineering team, as well as our sales and marketing team, so we can grow our market awareness. We've hit on a few different exit strategies that are important. The biggest ones involve telemedicine providers, various hospital systems, and EMR developers, as well as hardware developers like stethoscope manufacturers. So we think that we can be very competitive against some of the other telemedicine platforms, especially in the niches of telecardiology and transitions of care. So the 2 main goals were to engage with investors interested in our seed round, but probably more importantly, to start the dialogue with some of the clinical leaders who we hope will see this evening and reach out to us. We're looking for motivated physician leaders to help bring this back to their hospital system. So this is my contact information at the bottom, my email, my phone number. I'd be happy to take any questions.
Great. Thank you, Dr. Cerruti, for your presentation. That was awesome. We do have a few questions, so I'll start with those from our audience. Is there any IP around the tele-exam or the way that VP exam is set up?
Yeah, there is proprietary intellectual property as well as FDA oversight that we think gives us an advantage.
Great. And a second question really is around, do you have any data in a pilot, so any clinical pilots that have shown how many readmissions is what I would say, have been avoided? And what other clinical utilities have you seen with this? So I think about HEDIS metrics because I know readmission rates are one of those. So are there other metrics that you're looking at? Have you done pilots? And then a follow-up to that, what are you seeing from a patient satisfaction perspective?
Those are great questions and quite a few of them. So if I miss any of them, redirect me.
I will.
So the clinical pilots was our focus. We had multiple skilled nursing facilities, mainly in the Northeastern Ohio region. And we were able to pilot the system. And we did see overall around a 20% reduction in readmissions. The biggest opportunity is for our sicker patients, our advanced heart failure, our end-stage COPD patients. We think there's the biggest bang for the buck. And we have monitored the patient satisfaction closely. And patients really love when they can still see the physician who discharged them from the hospital overseeing their care. We think that really improves transitions of care. They can pick up on errors in medication transitions and other orders that may not go smoothly. So we've seen a lot there. We've also looked at efficiency. We've been able to document that we can reduce the amount of time the telemedicine visit takes. Back when I started telemedicine, I had to tell a nurse, move a stethoscope to this place, this place, this place. No, that's not right. And then move the camera here, here, and here, and it would take me 10 minutes. We could show that we could improve efficiency and you could review the entire physical exam on the physician side in about 30 seconds, which is great. No more than a minute. And it's taking the nurses on average about 3 to 4 minutes to perform the physical exam. So it's efficient for everybody. I think that's important. Our upcoming quality improvement projects also focuses on other things. Like, are we just going through the steps of doing telemedicine, or are we actually changing care? Are we altering medications? And are we making big decisions like should the patient be readmitted or not? And those are softer outcomes, but I think they're important.
Great. So a few other questions. I think we still have a couple of minutes. So I'll come back to a follow-up on the IP in just a minute. But there was one question around what happens when a patient does need to be readmitted or emergent patient referral type of thing. Does your system help in that process? And then a second question related to that really is around any risk or liability for using your system that might be incurred, again, if a patient is getting worse and this could be missed and something bad happens in the home?
Yeah, so great questions. The way we usually set up the system to be used is we're discharging them and we can see these patients sooner. We can ensure that they have a 1 week follow-up and then a 1 month follow-up. So we're improving the regular visit frequency, which is helpful, but more helpful is we can identify certain clinical signs and symptoms that automatically create an urgent encounter where the discharging cardiologist, nurse practitioner, internal medicine doctor will see the patient because they've gained 4 pounds of weight, they're increasingly short of breath, they're requiring higher oxygen demands, and then the nurse is sending us the full physical exam data, and that really helps, it helps improve your confidence. I think as a physician, it's easy to panic, and you hear a nurse and they're concerned about a change in clinical condition, and some of us think, well, it's easier just to bring them back to the emergency room and let them sort it out. But really what we're showing is improving confidence, improving the data that the physician has available, listening to the heart, the lungs, and seeing JVP, lower extremity edema. It makes you more confident about what's going on and whether you can safely keep that patient in the current level of care or you need to move them to a higher level of care. So if anything, I think it's going to significantly reduce liability. It's giving you access to more data as opposed to just usually a phone call, maybe a video visit. We're still missing a lot of things. So I think this is a step from the cardiologists, pulmonologists, and specialists I've worked with in the right direction to help reduce liability.
All right, so I'm gonna finish up with one final question. I'm gonna come back to the IP question. So what specifically is the IP? And similarly to that, what is to stop Cerner, Epic, Allscripts, those folks from really implementing something very similar to this within the EHR?
Yeah. So, you know, we've worked on our intellectual property strategy very early on. And we think that the clinical data that we've produced is important. And we think the FDA oversight is an important separate step. I mean, I think this goes toward our exit strategies with EMRs, that they'd rather look into systems like ours that have good clinical data and have already partnered with large academic institutions to show its value than to try to build it from the ground up as we did over 6 years ago. So, and I'm happy to discuss it. You know, anybody with more interest, we can go into more detail.
Well, that's fantastic. Thank you again for being here to present. Thank you for answering the questions. I know there are a couple of questions that did not get answered for the TelehealthCare Solutions team and Dr. Cerruti. We will have the opportunity for everyone attending tonight to join us in a Pitch Club, AngelMD Pitch Club LinkedIn group. And this will be a perfect opportunity for folks to get their additional questions answered, as well as Dr. Cerruti to put some of your clinical data and those types of things that people were asking about from your studies in that chat as well, in the LinkedIn group. So more to come on that.
Great.
Thank you again for being here. We will put up a poll now. So for those of you that are attending, we would love your feedback on the TelehealthCare Solutions and the VP exam. Again, this feedback is very valuable to our startups. So we would love all of you to participate and give us your feedback on, oops, there we go. We would love for all of you to give us your feedback on how they did tonight, and we will give you a few minutes to do so. And in the meantime, Jennifer is going to talk to us a little bit about our AngelMD Clinical Advisory Board.
Thank you, Katie, and thank you everyone who's joined us tonight. The last few sessions, I've encouraged our attending physicians and dentists to join our clinical advisory board. We're grateful to have a large and growing group of really interesting and engaged physicians. And this is a group that we invite to evaluate startups. And in return, they will get warrants for their startups. It's also a group that we turn to for expertise. Tonight, however, I actually want to take a second and encourage any of you that are working with startups, part of a startup yourself, you're investing in startups, to encourage them to register on AngelMD. It doesn't cost anything, and it gives them an opportunity to get exposure to well over 10,000 expert members that we have on our platform: physicians, dentists, investors, hospital executives, and so on. And it's also an opportunity for them to be eligible to participate in events like tonight and actually be presenters, as these three great companies are today. So thank you again for joining us tonight and for encouraging people that you know and great startups to come and join us on AngelMD.
Awesome. Thank you, Jennifer. Again, it looks like we have 63% of you voting out there. You still have another minute or so. We would love for everyone to give their feedback to Dr. Cerruti, as well as TelehealthCare Solutions. Again, this feedback is very valuable. They take this really to heart. I have to say, out of the three teams that we have here tonight, we have all been excited to engage with them over time, and they are so hungry for feedback and want to know how they can improve their solutions and be more valuable to you all as clinicians, and to help, in the end, to help patients. So please, please, please give them some feedback. And again, I just want to remind everyone, when we go through the Q&A, you have two options. One is the chat and the other one is the Q&A function. Those should be both on your Zoom toolbar at the bottom. We would love for you to use the Q&A function as opposed to the chat for your questions. I see someone right now also has their hand raised. Unfortunately, we're not taking live questions. So if you have a question, go ahead and put that in Q&A, and we would be happy to, Dr. Cerruti will answer that for us after the event in our LinkedIn group. And you all will get a link. I will put that in the chat so you can join the LinkedIn group as well. And that's where we would love to continue the conversation. So again, thank you all for being here. We are going to move on to startup number 2 this evening. And we have Liz Dickinson with us tonight, and she is our CEO and founder of Relish RX. Liz, thank you for being here. You can go ahead and share your slides, and we look forward to hearing all about Relish.
Great, thank you. Speaking as someone who has experienced firsthand the benefit of medically assisted weight loss, I'd like to thank you for the opportunity to tell you about Relish. It's a business born from my own drama of trying to lose weight. So this is likely not a surprise to this audience, but according to the American Board of Obesity Medicine, there are only 4,000 doctors trained in obesity treatment, and that's less than 0.5% of the US primary care physician population. And despite the fact that there have been a lot of advances, and there are several effective modern weight loss medication, doctors just aren't prescribing them. 24% of prescribers account for 90% of the subscriptions. And interestingly enough, 77% of those scripts are still for phentermine, which was actually approved in 1959. And they're actually being prescribed for longer than the 3 months that they were actually approved for. In 2015, just 2.7% of the prescriptions being written were for the newer weight loss drugs. But what this means is that there is a significant opportunity for doctors to make a difference. People listen to you. They listen to their doctors. In fact, if you just tell a patient he or she is overweight, that resulted in a 5% body weight loss within a year. When doctors are involved in weight loss, over 70% of patients were able to discontinue their diabetes medications. We aim to be the platform that you recommend your patients to. One of the great breakthroughs in knowledge around how to treat obesity has come from the 17,000 person CDC Kaiser-led Adverse Childhood Experiences study, which was started in the 1990s. So the ACE study revealed that adverse childhood experiences were very common, even in the white middle class. So over 65% of the population has at least one ACE, and 13% of the population have 4 or more. ACEs are linked to every major chronic illness and social problem that the United States grapples with and spends billions of dollars on, including obesity. ACEs create toxic stress, which changes the physical structure of the developing brain. And later in life, these changes result in addictive behaviors, including the overeating that leads to obesity. So obesity is in part a neurological disease. Jeffrey Flyer, Dean of Harvard Medical School, has shown, like many others, that repeatedly eating more calories than you burn can actually damage the hypothalamus. With so much calorie-dense food available, the hypothalamic neurons get overloaded and the brain can't tell how much body fat is already stored. The response is to try to store more fat. So there's actually really strong scientific evidence that obesity is not about people lacking willpower. So it's for these reasons, through the lens of addiction treatment, that Relish has chosen our program components to assure our clients' success. Our program begins with a doctor's visit, into which we incorporate the ACE questionnaire to give us an understanding of our clients' root causes of obesity. We've chosen prescription medications, bupropion, naltrexone, to target both the cravings and the reward centers of the brain, the centers that have been damaged by toxic stress and overeating. And further, we take into consideration that behavioral modification almost doubles the efficacy of medications alone. So the teaching of those skills is incorporated into our treatment. And because, as Dr. Folletti discovered, eating soothes anxiety, fear, anger, or depression, not eating has the potential to increase those emotions to levels that are intolerable. In fact, that's why weight loss so often fails and 90% of people regain their weight. Being overweight is often the solution to deeper, complex emotional issues, and that's why we have group therapy for people with addictions was proven to significantly improve quality of life. Our psychological interventions are delivered by chatbot, clinically proven at Kaiser, include techniques drawn from hypnotherapy, guided imagery, meditation, stress management, and relaxation practices. So among the direct-to-consumer weight loss offerings, only 2 other companies offer treatment by physicians, Calibrate and Roe. Calibrate prescribes GLP-1, a hormone that works on insulin production. Their model is perhaps the closest to ours. It offers personal coaching for behavioral modification. But Calibrate still does not treat the underlying psychological or neurological root causes of obesity, the root causes which ultimately lead to insulin resistance in the first place. And on average, other commercial programs claim about 5% weight loss, or Livongo, if people are really engaged, can claim 7%, as compared to the clinically proven efficacy of bupropion, naltrexone, combined with behavioral modification at 12% weight loss. So we're now at the point where we're ready to begin our lead generation campaigns to build up our prospects for a January launch. We've got a free pilot going with 12 people in it. Our expectation is that by the end of our 12th month, we'll have become cash flow positive and generated over $500,000 in revenue and brought on almost 900 customers. At the beginning of the new year, we'll start to charge for our services and bring on our telehealth partner, Amwell, who we're contracting with. I bring to the position of CEO significant experience raising capital, launching products, and scaling a business. So I'm best known for the creation of Mio, the world's first continuous strapless heart rate monitor watch, which I sold to Adidas. And other members of the founding team and advisors include some of the most important figures in the world of weight loss and digital health. We're looking to raise $500,000. Our valuation is reasonable at $2 million, and our plan is to use the funds to refine our advertising strategy and to create our own integrated app. So we hope you too will choose to invest in the Relish revolution. Thank you for your time.
Liz, that was awesome. I I'm right there with you. I am a kindred soul in that through 2020, despite a pandemic, I actually went through my own weight loss journey, and but I did it face to face. And what I will tell you is, with the clinic that I worked with, they were scrambling to figure out how to do this virtually. So the idea that you could pull together all of these resources in one place and help patients do this virtually without having to go in to see anyone, I think is fantastic. So thank you for being here. I love it. I have some questions for you.
Great.
So from our audience first, again, this is a little bit more about your business model, and I know you mentioned it briefly. Is this a subscription model? And again, direct to consumer, or are there any go-betweens in the middle? And does your insurance cover it?
So we are definitely direct to consumer. It's $150 a month for the subscription, which includes everything. It includes the doctor's visits, follow-on visits. It includes the meds delivered directly to your door. It includes group, which happens weekly for an hour, and it includes the behavioral modification curriculum and the ongoing psychological support for, which includes guided imagery, hypnotherapy, etc.
So I will just say my initial program, I know, was 20 weeks. How long do you think folks are going to stay with this program, or how long is it going to take for them to reach their goals? What do you think the average will be?
So the average we expect, given the experience of our founding doctors and their frontline experience, will be about 12 to 14 months. And the reason for that is that people do what their doctors say. And if your doctor tells you, you've got to be in this course and you've got to take it for, a year, and you've got to take these meds, they'll do it. People are hungry for advice on obesity treatment from their physicians. It's a fact.
Great. So a couple of other questions. One would be, so you talked about $150 a month. What's the margin on that?
It's 61% gross margin. So we can actually procure the meds for $6 a month. The doctors actually that we require, you only actually need about 2 doctors for 1,000 patients. So the expenses are in the doctors and the therapists, but you don't really need a lot of them. Plus, you can set up an independent physicians association and hire doctors that are retired or doctors on mat leave, and keep your costs variable. So really, you're only looking at those expenses. So everything else is virtual, which means it's a really hefty margin.
That's great. So a couple of other follow-up questions. Talk about how do you expect the distribution of this and marketing of this, as it is direct to consumer, as you mentioned? And then what other partners are you looking at bringing into this model?
So direct to consumer is the right model to begin with. And the reason that it will be an effective channel for us is because we have so much content. Dr. Folletti did all the research with Kaiser and the CDC on the ACE study. We can talk for hours and days and weeks on the ACE study. Dr. Folletti is going to be doing weekly webinars for us. Dr. Allman, who's our Chief Behavioral Officer, has written 10 books, 7 on weight loss. And he has so much content on stress management, hypnotherapy, and we can do sessions with people and sell sessions. Lots of ways to get email addresses for very cheaply, and then deliver content and gradually move them up the value chain until we have the big ask, which is the $150 a month. But by then we'll have really established an ongoing relationship with our customer, which means we don't have to buy the expensive AdWords, all of the stuff that Noom is buying right now. We can keep our cost of customer acquisitions quite low. In terms of partnerships, I really believe that we will have a very strong partnership with our telehealth supplier, Amwell. They are already talking about advertising our services on their platform. And we believe, I had a great meeting actually with Providence not too long ago. First thing they wanted to do was introduce me to their internal group, because doctors for the most part would like to know or as I understand it, doctors have said they would like to prescribe a commercially viable program for their patients. And we believe that will be that program that doctors refer to.
Great. Again, thank you for being here. I know that we have several questions that came up that did not get answered, and we will put the link for the LinkedIn group where Liz will follow up with these questions and be able to finish answering the questions that were out there. You got a lot of questions, so we will, yes, so we will make sure that you get those and are able to answer them. But thank you so much for being here. Again, a project that's near and dear to my heart. So congratulations. I hope it goes wildly crazy. That's fantastic.
Appreciate it.
All right. So we will put up now our poll number 2, which is about Relish. And again, for those of you that are in our audience, please, please, please give feedback to them on how they can make this program better. Again, all of these startups and CEOs are interested in improving and really appealing to our physician and clinician audience. And the only way that they can do that is by getting your feedback. So please fill out that poll and give them an opportunity to improve. And while you're doing that, we have Mike Raymer here tonight that's going to talk to us about a couple of things, I believe, but absolutely for sure the AngelMD Venture Partner Program. So Mike, I will let you take over.
Thanks very much, Katie, and congratulations to both companies. I think the virtual care space is certainly very hot. I think many people saw the merger between Livongo and Teladoc for $18 billion. And the reality is that those big telemedicine companies have established a footprint of customers, and they're kind of blocked in growth. I think their growth is going to come from specialty businesses. And so I applaud your focus on the skilled nursing area, which is, I think, a big gap from a virtual care perspective. A shout out also to Liz. I've been part of their cohort. I think I've lost 13 pounds so far. So thanks very much, Liz, for your help in that. I want to introduce the Venture Partner Program that Tobin and I have been working with our senior clinical advisory team. Really, it's to allow the most active investors in a network to really gain an economic advantage. We capped participation in this network at 50 individuals, and we're targeting by Thanksgiving to have all those commitments in place. The economics are really tied to both ownership at AngelMD, premium access to advisory opportunities, working with startups. And, our mantra is not just to, identify great companies, but also help build great companies. And so this team will play a really critical role in that, and really be able to attain significant discounts on any investments on the platform. So financially, really, it's a no-brainer. We're not going to dive into great detail this evening, but if you have an interest, there'll be a follow-up document come out post this meeting, and simply respond to that and express your interest. But again, I appreciate all those that have dialed in this evening, and a special shout out to Jerry Mattis, which I have not seen in years, but we worked together back in my ventilator days at Puritan Bennett. I'll turn it back to you, Katie.
Great. All right. It looks like we have 74% voting. I'm going to give you a few more seconds, and then we will move on to our last company of the evening. Again, I want to reassure you, no matter what it looks like I'm doing to these questions in the Q&A, we have copied them all down, and they will be the ones that have not been answered will be put to our CEOs, and they will have an opportunity in our LinkedIn group to go ahead and answer them. And during our last presentation here, I will put a link to that group. So if you are not already a part of it, please join our LinkedIn group so we can continue the conversation. It's definitely one of the highlights, I think, is getting to interact with these CEOs and startups on an ongoing basis. So Thanks to the two that have gone already. And last but not least, we have Kathy Ford here with us tonight, and she is the president and chief product officer for a company called Rhinogram. So Kathy, I'm going to turn things over to you.
Thank you very much, Katie. Before I get started here, I want to just really quickly introduce our founder and CEO. This is Dr. Keith Dresser. He is a practicing orthodontist. A lot of times we present together, but with 7 minutes, we are going to be efficient and just get going. So with that, I will bring up my slides here and get started. So Rhinogram took every person's preferred way to communicate with friends and family and made it possible to use in healthcare, HIPAA compliant and ONC certified. We know that portals have a pretty low adoption rate. We also know that if you are one of the 30% of Americans today without broadband, you can't even get into your patient portal. Physicians and their teams don't need more added to their plate. We all know that. No one knows this better, especially than our founder, Dr. Dresser, and his staff that use Rhinogram every single day. Dr. Dresser's deepest beliefs are that technology should only be implemented if it's truly going to make a tremendous difference in everyone's day, including the patients. And if he were speaking, he would tell you that himself. Rhinogram checks all the boxes though. So Dr. Dresser doesn't believe in technology just for technology's sake. Systems up to this point have really been focused on adding versus subtracting. I think everybody can relate to that in the healthcare industry. Various tasks added to everyone's day. What we do is focus on streamlining processes that subtract tasks and add time back to everyone's day. So what we do is we text enable the existing practices phone line. So the phone works just the way it always has. Calling isn't affected, but now patients can text on it as well. We integrate with Facebook Messenger, so all of your social media traffic from a business page is consolidated into one platform to then be routed to the right person to respond. Might be an insurance question, maybe it's an appointment change, prescription refills are really common, so any of these and so many more. This solution is compliant and it integrates really nicely with all of the EHRs and practice management systems out there. This solution is not in conflict with an EHR. It's not a challenge to have both at all. We're quite complementary, in fact. We integrate with just about all of them, but we are in the app stores for Epic, Athena, and Nextech. So we have great partnerships and can leverage those installed bases, which is terrific for growth. So the patient only has to text to the exact same phone number that you're asking them to call you on that they already had in their phone. Being a cloud-based solution, the entire care team has access to this application, either on their mobile phone or from a browser, and have mission control like features, we like to say, to be able to route and respond and manage conversations that previously would have been more on a one-on-one basis and probably over the office telephone. So, or in some cases, maybe even through email or through the portal system of an EHR that typically doesn't have any kind of workflow efficiency whatsoever, unlike Rhinogram, for example, our templated responses. So with the entire care team having access to the platform, they can do things like all be virtual and still be communicating with and about patients, tasks, and topics. So your virtual work from home solution or your virtual office, you can use preloaded industry specific templates for frequently used responses, eliminating a whole bunch of typing. So messaging with patients gets down to literally a second or two. Physicians have seen over 20% over 20% improvement in time savings because topics are triaged quickly by the right team member. More patients can be seen virtually and faster, especially when they're low acuity and don't need to come into the office. Stay at home, be treated at home. Save all that in-office time for higher acuity patients who need to be seen in person. So your overhead is reduced, your revenues are increased. We deliver this solution as a turnkey offering. This is really important, and really leverage that approach, thank goodness. When during COVID peak, we were bringing some practices live within hours, no joke, to aid in dealing with their high volumes, totally disconnected teams, and in some cases, keeping the virtual doors open when the physical location was required to close. In many states, that was the case. So we were flooded, and very happy to help solve those problems. What's important to note here is that we really are a virtual care platform. Rhinogram is an elegant solution with a very comprehensive set of features that support everyday tasks in the entire patient journey. We seamlessly integrate or sit in tandem with your existing system. So again, this is an addition to what you have already. So for other needs like requesting payment through text, having e-forms sent out and then e-signed, sending and receiving images from patients, insurance cards, translating on the fly for your patients who have a different native language. These are all examples of what this platform brings and makes it easier on every person in the practice, and it provides a fantastic patient experience. We have so many amazing Rhinogram success stories, but I'm just going to focus quickly on one here and tell you how amazing Sweetgrass Pediatrics is doing with Rhinogram. They not only have 90% of their current active patients texting through Rhinogram, but in the last 6 months of this year, they have transmitted over 200,000 messages. High usage, they love it. And honestly, it's nearly impossible to take a solution like this out because everyone loves it. And it has led to our 99.5% client retention rate. That is not a stutter, 99.5%, almost unheard of. We're so thrilled to be in not just pediatrics, OBGYN, and orthodontics, as you see here, but we now are in 34 unique specialties. Things like orthopedics, dermatology, ENT, behavioral health, and the rest. So we're ubiquitous across all specialties in care and look forward to seeing more customers there. And running out of time here. So as a SaaS-based solution, we are in everything from health systems, large outpatient clinics to small practices. We have annual contracts that are priced on a per provider per month basis. We've been growing revenue, as you can see, over 200% year over year since 2017. So 3.5 years live, and we have over 5.5 million patients receiving care on this platform. We are growing like crazy. We have incredible revenue opportunities with just 1% penetration equals over 100 million in new revenue each year. With the funds that we're looking to raise, we are going to accelerate our sales and marketing efforts, maximize growth, and leverage market conditions where we're at. We are in a current raise right now. We still have 4.8 million open, and we're looking to fulfill that. And we would love to have more conversation about what that means.
Kathy, thank you so much for being here. You're lucky I didn't have my gong tonight because we're a little over time, but it's okay.
I know.
We'll give you a break. No, great presentation. Again, thank you for being here. We really appreciate all of our presenters and CEOs and founders tonight, 3 great companies. We're going to go ahead and do some Q&A on Rhinogram, and we got a lot of questions again. We happen to have some social media specialists in our audience tonight, and there were a couple of questions around the HIPAA compliant aspect, because I would say a couple of things. Most of us think, well, how can social media messenger be HIPAA compliant? And how can text messaging be HIPAA compliant? Because those of us that are in this realm know that actually we should not be answering medical questions that way. So I will throw that question over to you.
It's a great question. So to be brief, a couple of things. One is the HIPAA compliance, of course, is the responsibility of the covered entity, not of the patient. So the patient can send whatever they want. It's all about what you do with that information once you receive it, and ensure that it's encrypted and logged, non-editable, and permanently stored, which is what we do. We also manage HIPAA consent on our platform, which is the second piece, very important. So we have a method around capturing HIPAA consent through our texting platform, to where the patient does recognize that they're sending PHI in this manner and that they agree to it. And that is an acceptable way to manage that risk from a provider standpoint. So we are in fact HIPAA compliant. And by the way, we are ONC certified, which we would have never received that if there was truly any kind of breach or issue with the compliance.
All right, we may want to see a little bit more about that, I'm guessing in our LinkedIn group, but thank you for that answer. There was another question around your revenue model and what's the cost to the practice, and talk a little bit as well on the implementation, because I think for any practice, that's one, I would say, of the biggest headaches, right?
Yes, no doubt. Is the legacy of healthcare IT for sure, but certainly not Rhinogram. So first, let's talk about deployment. As I mentioned, we did and can bring sites live within hours because it's incredibly intuitive, easy to use. It comes with a whole bunch of pre-configurations, templates, and tools in order to get a practice up and running based on a whole bunch of KPI and previous work that we've done in order to do that. So that's the first element from it. It's a completely cloud-based solution, and so everybody has access to it from a browser, which makes it also incredibly easy and convenient. We have also mobile apps on both Android and iOS. From a payment, who pays for it? So certainly the delivery organization is who is paying for it, and our pricing model is per provider, per year, per location model. So we make it also really simple, try to take out all the nickel and diming that has been in our industry for a very long time, and super easy to contract.
Great. This one's probably a big one, but I would love to hear a little bit, because I know there are many, what I would say, semi-comprehensive telehealth solutions in the market. And you're competing against some biggies, right? Some big guys that have gotten a ton of funding. So what sets you apart specifically from some of those other competitors?
Yep, I definitely love this question. And it is a very confusing market right now, especially with Teledongo and some of the other activities in the market recently. It's a whole bunch of sort of, to break it down, what is telehealth, telemedicine, and the rest. What's really important to note is that we're a virtual care platform. So we support the entire patient journey. And it is our mixture of capabilities that make us unique and different from literally every other platform in the market, which includes, by the way, we are the only platform that has Facebook Messenger integrated and consolidating through our platform as well. So it is the fact that we can support an entire patient journey virtually without the patient ever needing to come in, but we also support the hybrid approach as well. So everything can be done pre-clinical without the patient ever leaving their home. And then all the post-clinical follow-up and engagement and discharge instructions and after-hours triage and all of those other really important things post-visit, we support as well. And so I would tell you that most other players in the market don't have that kind of comprehensive solution.
Great. So one last question, because one of the things that stuck out to me really is your, I think you said 99.5% satisfaction rate of these practices that are taking on your product. Tell me a little bit more about that, and what do you think makes practices give you that feedback. Like they're coming back for more year after year, right?
Yeah, I mean, I think very simply said, it is just so darn convenient for both the patient and the practice. It adds value on both sides. And so when something is adding value in such a way, why would you ever turn it off? And we've actually had a practice that had a new executive come in and felt like maybe there was overlap with their EHR and turned Rhinogram off. And literally there was complete outrage with their patient base. It took just a couple days for them to come back and ask us to figure out how to reinstate them, which we did immediately. And unfortunately, that executive lost her job. But it was really actually quite, well, validating is, we don't even need that really at this stage, because it is, it's just so sticky. I mean, who doesn't, once you have the ability to text, and once you see how responsive, how convenient it is, you never want to just stop offering it.
Great. Thank you, Kathy. Thank you for being here. Thanks for presenting on Rhinogram. We are going to launch poll number 3, which is to give feedback to Kathy and Rhinogram. Please, 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 again, go ahead and give us feedback because, again, it's really important to our startups and our presenters. And again, I am going to expect everyone 100%. Come on. We want as much feedback as we can get for these folks. Again, they take it to heart. They really do. I can say for certain, this group really values any feedback that they get. And I have really enjoyed working with them. And I think Mike and Jennifer would say the same thing. So while you are filling out the poll on Rhinogram, I want to highlight a couple of things that we talked about. Again, we are looking for clinicians to do a couple of things that help make AngelMD better. One of those is to refer any startups that you know of, or you advise, or you're involved with. AngelMD gets stronger the more startups we have on the platform, and it helps us really be able to, I would say, invest in the best, which is part of what we're looking to do. The second piece of that really is our AngelMD Clinical Advisory Board. And if you're a clinician and you would like to join, we will definitely, we will be sending out an email to everyone at post this event that will have a few things. One would be a link to an application for our clinical advisory board. So if you're interested in being a part of that, we would love to have you. The next thing that I would say we want, as Mike talked about, for those that are interested in being part of our AngelMD Venture Partner Program and are interested in potentially being investors in our Catalyst Fund, etc., we will also be sending information out about that opportunity, and we would love to have you. All right, 82% voted. That's what I'm talking about. I'm going to put one more time in our chat the link to the LinkedIn group. We again like to continue our conversation there. This is where all of our startup founders and CEOs that are here with us tonight will answer any unanswered questions. So please join us there. And Tobin, thank you for reminding me. Our next pitch club is December 1st. And it's going to be really cool, I think. It will be definitely our kind of a highlight of some of our AngelMD portfolio companies, which I think will be awesome. It's going to be where are they now, right? And I think while we're finishing up this last poll, Mike Szymanski, you also had something you wanted to add.
Yeah, although some of this feels a little bit like I'm on a PBS special, like get those polls in, keep the phones ringing, you know, because I'm about to pitch the next thing.
Machines.
Right, exactly. It's only a network like ours that can bring this kind of product to you on a weekly basis. But truly, one of the powers of the AngelMD network is the ability to reach out and scan through hundreds or thousands of companies on an annual basis to look for the best and the ones that we think are most unique. And I don't want to think people to think that we go through and just grab whatever companies happen to have come up this week and put them in front of you. We actually culled through dozens of companies in order to figure out the ones that we think are most interesting. And we don't always pick the ones that are going to be the hot name brands, but we pick the ones we think are at the most interesting tipping point of their path to market. And that makes them really the most intellectually engaging and the most exciting. And that's why we like to bring them here. And especially at Pitch Club, we like to experiment a bit to put them in front of you as our physician and expert audience to get your opinions and your feedback. And so that's really why we want to drive as much interaction as possible. And with that, I hand it back to you, Katie. I'll put in one pitch for like the next one. Part of the portfolio analysis and bringing them back is because we will be talking a lot more about the Catalyst Fund launch. And we want to give you an example of what companies we have been investing in and that we intend to invest in the future. But we'll be here. You'll be hearing more of that from us in the future.
Great. Thanks, Mike. That was awesome. I will stop my PBS sales pitch and say thank you all who
Don't stop the pitch. Don't stop the pitch. It's all right. It's fantastic. I'm just going to stop you if we start handing out umbrellas. That's all. That's where I'll stop you.
I want to say thank you to everyone who joined us this evening. Again, we like to have fun at Pitch Club. I want to say thank you to TelehealthCare Solutions. I want to say thank you to Relish. I want to say thank you to Rhinogram. And thanks for all of our attendees for all your great questions and for making this a great night. And we hope to see all of you on December 1st for our portfolio showcase. Thank you, everyone, and good night.